What's up guys, Dr. Jared here. In this video, I want to show you how to realign your pelvis and eliminate SI joint pain or sacroiliac joint pain. I love to show this one in my physical therapy clinic because the effects from this are so immediate. I hope that you get a significant amount of pain relief from this as well. But before we jump right into it, let's make sure that you're in the right place. What is SI joint pain? This is pain that you get right down here low in your pelvis. This is like low lower back pain, way down in this area. The anatomy behind it is you've got three bones that make up your pelvis. You've got two bones on the outside, those are called your ilium, these bones right here. And then in the back, you also have this wedge-shaped bone, it's called your sacrum. Basically, it's the bottom of your vertebrae sit right on top of that sacrum. Now, where those bones come together, the sacrum and the ilium, you have what we call a sacroiliac joint. They call it a joint in the sense that it's where two bones come together, but really there should be no motion that occurs. This should be a very stable ring. This should be a very stable structure. You start to experience pain when there has been some motion that occurs or when one of those bones is slightly out of alignment. That's why this technique works so well to put that back into place. The reasons why you get this, first and foremost, probably the most common one that I see is pregnancy. As your body is preparing to have the child or after you've had the child, that joint or that area becomes very loose just because baby has to pass through that hole right there. And so pregnancy is definitely one. Slip and fall or accident or trauma, car accident, those are certainly another one. Another common one is if you spend a lot of the day standing and if you kind of have a tendency to stand kind of on one side more than the other, or if you sit throughout your day, you sit with your legs crossed a lot, that kind of tends to throw off the alignment of the pelvis as well. When those bones are out of alignment, that is what causes that pain down there, and that is what we want to get rid of. And so what we want to do is put it in better alignment, and again, I'm going to show you how to do that in this video with this mobilization technique, but then we also want to keep it in that good alignment. That takes place with strengthening exercises. So after the mobilization technique, it's important that you strengthen and stabilize the joint so that it stays in that position. I've got a video about that. I will link it for you at the end of this video as well. Now, like I mentioned previously, if we can get those bones into the right position, you start to experience relief pretty immediately with this. And again, I hope that that's the case that you find with this video. If it is, do me a favor, leave me or comment your experience down below. I always love to hear from you guys. I'm curious to hear how many of you try this, how many of you get some pretty good relief from this. If you get some good relief, make a comment down below, hit the thumbs up button. I love to hear from you guys. And so that being said, let's run through this mobilization technique. What we'll do is I'll explain the whole thing to you at first here initially, and then what I want to do is run through it with you real time. So we'll do an explanation, we'll run through it real time, and hopefully you start to feel better. So coming at you right now. For this mobilization, we're going to use a muscle energy technique. Basically, we're going to fire a lot of the muscles that act on the pelvis and use that muscle contraction to pull it back into better alignment. In order to do that, we do need three simple pieces of equipment. I've got a golf club right here. You can also use a broom or a mop or a piece of pipe or a dowel if you've got one of those laying around your house. I've got a small ball here. You can use a small ball or also a pillow or a couple of pillows also works well. And then finally a belt. I have a physical therapy belt or a gait belt here. You don't necessarily need that. You can just use a regular belt that you would wear like with your pants. Also works great for this. So let's go ahead and get started. Again, I'm going to run you through 5 of these different muscle energy patterns, and then hopefully your SI joint feels better after that. And so we're going to start with your golf club, broom, mop, whatever it is that you have. I'm going to put that between my legs and then I'm going to grab both sides just like this. So right now it's under my left leg, but it's on top of my right leg. I'm going to hold that nice and strong while I push down with my left leg and pull up with my right leg. So kind of a scissor motion. And then you're going to push really hard, 1, 2, 3, hold it about 3 to 5 seconds. And then you're going to repeat that 3 times. But then we want to go the other way as well. So now I'm going to switch it up. And so now my right leg is on top of the golf club. My left leg is, my right leg's the golf club's behind my right leg and it's on top of my left leg. That's what I'm trying to say. So now we're in this reverse pattern, and then it's the same thing. I'm pulling up into the golf club with my left, and I'm pushing down into the golf club with my right. I'm gonna push, 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 hold 3 to 5 seconds, and then I'm going to repeat that 3 times as well. Next, we're going to grab the ball, and so we're still laying on our back with our knees bent. I'm gonna put that ball right between my knees, and then I'm going to push together. So use those adductor muscles, those groin muscles. We're gonna push together and hold 1, 2, 3 to 5 seconds, and then relax, push and hold 1, 2, 3, and then we're going to repeat that 3 times. And then next, we're gonna grab the belt. I'm gonna loop that around my knees, just like that. And so let's make that just a little bit tighter. There we go. And so now in this position, what I'm going to do is push out against the belt. So I'm pushing out against that resistance, and then I'm holding 1, 2, 3 to 5 seconds, and then I'm going to repeat that one 3 times. On this one, it's important, so don't get an elastic band. Don't get like one of those booty bands or those elastic straps. I need something that's going to hold basically your pelvis and your legs in one position. So use a belt that does not stretch. We're going to hold that again 3 to 5 seconds and repeat that one 3 times. And then the last contraction is going to be for your hip extensors or for your glutes. What we're going to do is squeeze the butt and lift the hips up in a bridge position. Hold that really nice contraction, 1, 2, 3, and then come right back down. And then we're also going to repeat that one 3 times. So here's what it looks like in real time. All right, so in real time, let's start with the golf club. I'm gonna go behind my left knee and on top of my right. I'm gonna push down with my left and up with my right. So push and hold, 1, 2, 3, and then relax. Do it again, hold, push, 1, 2, 3, and then relax. Last time, we're gonna push and hold, 1, 2, 3, and then relax. Now we're gonna switch it up. I'm gonna go behind my right knee and in front of my left knee. Same thing. I'm gonna pull with my left and push with my right. 1, 2, 3, and relax. Do it again. 1, 2, 3, and then relax. Last time. 1, 2, 3. Good job. And so now let's grab your ball or your pillows. We're gonna put that between your knees, and then we're gonna smash that ball. So squeeze, 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 and hold. 1, 2, 3, and then relax. Squeeze and hold. 1, 2, 3, and then relax. Last time, squeeze and hold. 1, 2, 3, and then relax. Next, let's go ahead and we'll grab the belt. We'll put that around our knees. And now in this position, we're gonna push out against the belt. And so you're gonna push and hold, 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 hold. 1, 2, 3, keep pushing, good, and relax. Push and hold, 1, 2, 3, and then relax. Again, we're gonna push, 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 hard, 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 2, 3, and then relax. And then finally, the last thing we're going to do is some bridges. And so now we're gonna contract the glutes, lift the hips up off of the floor, off of the table, whatever you're on. Hold 1, 2, 3, and then come back down. And then again, really trying to squeeze the butt together, really trying to smash the glutes, 2, 3, and then relax. And then one more time, up, 1, 2, 3, and then relax. And that's it. That's your muscle energy technique. Again, hopefully you notice or you appreciate some pain relief with that. Again, it's one thing to put it into place, but to keep it there, we definitely need to strengthen those muscles that act on the SI joint. As I mentioned previously, if you're interested in that video, and I highly recommend that you do some of these, check it out right here. This is the video that you need. YouTube, for some reason, thinks that you might like this video from Tone and Tighten, so check that out and see if YouTube's right. If you haven't subscribed to the channel yet, hit the circle right here to do that. I would love to see you back for future videos. Until next time, I hope you feel better. We'll see you again on Tone and Tighten.